Hello, my name is Emma van Daalen from Leiden University Medical Center in the Netherlands. In this podcast, I will briefly describe the main findings of research that my colleagues and I have performed on anti-glomerular basement membrane disease. This is a life-threatening autoimmune disease affecting the lungs and/or kidneys. Patients are treated with plasma exchange and immunosuppression. However, this treatment does not prevent the development of end-stage kidney disease in the majority of patients. However, large studies on long-term outcome are lacking. In this study, we included 123 patients with anti-GBM glomerulonephritis from 6 centers worldwide to investigate their long-term kidney outcome, defined as the occurrence of end-stage kidney disease, and to find out which clinical and histopathological parameters best predict kidney outcome. For histopathological evaluation, the classification for ANCA-associated glomerulonephritis was used. Overall, the 5-year kidney survival rate of this cohort was 34%. Interestingly, patients diagnosed after 2007 had a twofold higher kidney survival rate compared to patients diagnosed earlier. The kidney survival rate was lower in patients with dialysis dependency at presentation, lower percentage of normal glomeruli, and greater extent of interstitial infiltrate on kidney biopsy. When applying this pathological classification for ANCA-associated glomerulonephritis to our cohort of patients with anti-GBM glomerulonephritis, 15 patients had focal abnormalities on biopsy with 50% or more normal glomeruli. Only one of these patients developed end-stage kidney disease. Moreover, most patients with a focal disease on kidney biopsy were diagnosed after 2007, suggesting earlier detection of anti-GBM glomerulonephritis or increased awareness of the heterogeneity of the disease. Patients who were dialysis dependent at presentation and who had 100% cellular crescents on kidney biopsy or 50% or more globally sclerotic glomeruli did not recover kidney function. Thus, these histopathological parameters are indicative of a poor prognosis. In conclusion, we found better kidney survival rates over time and found that this favorable rate is associated with dialysis independency at presentation and greater proportion of normal glomeruli and low extent of interstitial infiltrate on kidney biopsy.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.